Over the past decade, the United States has jump-started a global health movement that is saving and lifting human lives on a scale never known before. In poor villages, communities, and countries around the world, remarkable progress is being made in reducing disease, giving millions a chance to live longer, healthier, more productive lives. That is why, at this challenging yet hopeful time, we must sustain and build on our achievements. To ensure that transformational progress for global health takes hold, we need a smart, strategic, long-term approach, one that harnesses all of America's assets and expertise, strengthens our partnerships with others, and seeks the greatest health improvements for people around the world. In early 2009, the Center for Strategic and International Studies, located in Washington, D.C., created the Commission on Smart Global Health Policy, in the belief that global health policy is a key component of smart power.
Smart power is making full use of all U.S. strengths and assets. It's leveraging our resources, our partnerships with other institutions. It's combining both our soft and hard assets. Global health is among the most powerful and effective instruments on the soft side for advancing U.S. national interests.
At the Commission's first meeting, co-chairs Helene Gayle and Admiral William Fallon laid out a mandate to develop a strategic, long-term vision for smart investments in global health.
What we really want is to look at solutions, to look at not only the problem, but to be able to talk practically about what works. There is, again, a lot to build on. We know a lot about what it takes to make a difference in the health of people, even in poor nations. But I think it's taking that tangible information and then figuring out how can that be a catalyst for our work.
I think we'll make recommendations for a way forward that would actually end up getting results, and those results would be a better state of global health and keeping more people alive that are succumbing to these problems today, and in the process making us a better world.
Simultaneously, a conversation began online at smartglobalhealth.org, where the Commission engaged with a community that grew to be 5,000 strong by posting updates, soliciting feedback, and spreading global awareness. A student essay contest soliciting ideas for a long-term global health strategy received submissions from 43 different countries and all 50 states. In August, Commission members traveled to Kenya to view firsthand the impact of U.S. global health investments and the challenges ahead.
We hope that this kind of tour will actually help to inform that, so that the recommendations will be much more based in the reality of the current day situation and needs. So this is the kind of tour that hopefully will give people the understanding to take back to policymakers, so that the kinds of programs that the U.S. government supports will really meet the needs of people in countries like this.
After the trip, the Commission met to review its progress and re-engaged with senior administration officials. Deputy Secretary of State Jack Lew spoke about making hard choices across investments.
One of the central challenges is how to think about what we're doing not as building systems, but about saving lives. And I think we need to think together, and it would be very helpful if you can help us think about how to create more of a moral equivalency between the lives saved, regardless of the threat.
Welcome today to the launch of the final report of the CSIS Commission on Smart Global Health Policy, a call for a healthier, safer, and more prosperous world.
After 9 months of work, the Commission released its report to a packed room of administration officials, global health experts, and journalists, with hundreds of interested participants following online. In its first 10 days, the report was downloaded from the website more than 20,000 times. It features 5 core recommendations for a smart U.S. global health strategy. 1. Maintain momentum against HIV/AIDS, malaria, and tuberculosis. The number of persons receiving U.S.-provided antiretroviral treatment has grown from 155,000 in 2004 to 2 million in 2008. With continued investment, the Obama administration can realize its goal of 4 million people on U.S.-supported treatment in the next 5 years. 2. Seize this moment to make women and children a top priority in global health. In the industrialized world, a woman's risk of dying in pregnancy or childbirth is 1 in 7,300. In Asia, it is 1 in 120, and in sub-Saharan Africa, it is 1 in 22. The Commission recommends that the U.S. double its maternal and child health and family planning efforts to $2 billion a year and focus its work on a few core countries in Africa and South Asia. 3. Elevate prevention and preparedness to true strategic priorities. The emergence of SARS, H5N1, and H1N1 influenza has made clear that human security and economic security are interdependent. Empowering developing countries to respond to disease threats is an investment in the well-being of the world's poorest individuals, as well as in America's self-interest. 4. Develop U.S. capacity to match our global health ambitions, with strong White House leadership, congressional support, coordination across agencies and departments responsible for implementation, and predictable long-term funding. Our aim should be annual investments of $25 billion by 2025, tied to clear, measurable goals. 5. Invest in multilateral institutions. The United States should work more closely with and promote a greater unity of effort among the World Health Organization, the Global Fund, the Gavi Alliance, the World Bank, and UNICEF, with a focus on getting the best results from each. The Commission's work continues beyond the release of the report. From engaging the public in a conversation about the report's recommendations, to strengthening U.S. engagement with international partners, to returning to Africa and examining how to ensure the success of the Obama administration's Global Health Initiative, and finally, reconvening the Commission to review U.S. global health efforts at the 2-year mark of the Obama administration. The world's expectations for U.S. leadership are high, but we can and should rise to meet them. The goal of reducing global death and disease and creating more resilient, self-sufficient partner countries reflects America at its best. Now is the time to take action and build a healthier, safer, more prosperous world.